Welcome to our channel. I'm Dr. Bruce Crawford. I'm a Board Certified Urogynecologist and the Director of the Center for Pelvic Floor Medicine. I started this channel to provide a trustworthy forum that provides access to information relevant to women's health with particular emphasis on the pelvic floor. Pelvic floor, what is that? Well, that's a good question. It's really incredible that there's a part of your body that you may not be familiar with, right? But it's really true. I see patients all the time in the office that have no idea what the pelvic floor is or why it's so important for their quality of life. We're going to do something about that. Before we go any further, let me take a moment to ask you to like this video, subscribe to this video, share this video, hit that notifications bell. This is going to help bring more people to our channel and create a community that we all can benefit on. Okay, great. Here we go. Let's get started. Topic number one, who am I? Well, I'm a medical director of the Center for Pelvic Floor Medicine, and I've been practicing here in the United States for 21 years. I became a board-certified urogynecologist in 2012 when that subspecialty became an officially recognized thing, but before that, for many years, my practice focused on pelvic floor issues. I'm a pelvic floor surgeon, but have stopped operating now as it's really my commitment and mission to help women avoid surgery for things like bladder control problems, bowel control problems, and something called Prolapse, which affects about half of adult women in the United States. You see, a urogynecologist is an MD or a DO that has special training and expertise in managing pelvic floor disorders. This training involves a lot of experience in the office and a lot of time spent in the operating room, and in our case in the lab, trying to understand how to prevent these things when they can't be prevented, how to treat them conservatively, not rushing to the operating room. We've seen so many problems with mesh-related complications and patients that were dissatisfied after undergoing an ordeal that is far from trivial. Pelvic reconstructive surgery is incredibly common, and in most cases, it can be avoided. In the early 2000s, I started doing some work in West Africa, traveling with a group of doctors repairing something called a Vaginal Fistula. This group is known as the International Organization for Women in Development, and a Vaginal Fistula is a terrible problem affecting 2.5 million women in sub-Saharan Africa. It occurs because of something called obstructed labor. That's when the baby gets stuck in the pelvis, sometimes for days, putting pressure on the bladder in a way that cuts off the blood supply to the bladder and ultimately causes that portion of the bladder to die, leaving a hole between the bladder and the vagina, which causes every drop of urine the body produces to flow through that hole into the vagina, making this otherwise healthy young woman completely incontinent. I'm sure you can't imagine how incredibly distressing that would be. And although we were often, almost always, able to fix this defect, fix this hole, many of these patients remained incontinent, and that was quite puzzling to me. And it was over the course of making these trips to West Africa that I came to understand that this problem of continence is not a mechanical issue. It's a neuromuscular issue. And given that, recognizing that, we need to come up with a solution that is a sophisticated neuromuscular solution beyond the general recommendation of go home and do your Kegel exercises, because you know what? Nobody does them. And so we got to work doing a great deal of research to find a method of pelvic floor rehabilitation that was practicable, one that could be incorporated into a regular fitness routine, and that became the Pfilates program. We're going to talk a lot about that on this channel. And we're going to talk about the things that you're interested in. Down below, leave comments. Let me know about topics you'd like to hear about, things that are of interest to you. If you have questions, I'll go through the comments, I'll answer those questions, and together we will take this journey as far as we can. I really appreciate you being here. I really appreciate your time. I look forward to hearing from you in the comments down below. And don't forget, share, like, and subscribe to this channel. Thanks very much.